Hello, everyone. Welcome back to another one of our Ask an Expert sessions. My name is Ryan Strauss from the IKEA Foundation. Really happy to welcome all of our live viewers and all the people who are watching a little bit later. Thank you so much for joining us. I'm very, very happy to introduce our moderator for today, Patricia Atkinson, who is the Chief Programs Officer for the IKEA Foundation. Patricia, how are you doing today?
Great, thank you, Ryan. And thank you to our audience for joining, and to those of you who submitted questions. We will answer them all. If we don't in this live session, we will provide answers online. Thank you for that. As Ryan said, I'm the Chief Program Officer at the IKEA Foundation, where we focus on improving the lives of vulnerable children by enabling their families to create sustainable livelihoods while fighting and coping with climate change. So on to our theme today. The world is currently dealing with COVID-19, but communities, and particularly the world's poorest communities, constantly face disasters and emergencies such as earthquakes, droughts, or conflicts. How can we respond effectively to emergencies and make sure that people in vulnerable communities get the help they need and are prepared when disaster arrives? So today I'm here with Sarah Klassen from the START Network and John Stone from the Risk Informed Early Action Partnership, better known as REAP. Two groups you may never have heard of who play an important role in how the world responds to emergencies. The START Network is a group of over 50 organizations working together to transform the way the humanitarian sector responds to emergencies and helps communities prepare, respond, and recover from crises. REAP is a global partnership aiming to make 1 billion people safer by expanding early action financing and improving early warning systems and the capacity to act on the risks they identify. START Network is one of REAP's partners. So welcome to our experts, Sarah and John, and now we'll dive into our questions, and I'll start with John. So tell us, what does early action mean? And in particular, what does it mean in the context of responding and preparing for COVID-19?
Yes, so early action is a bit of a technical word given to something that we probably all know about. I think anytime that we see something coming over the horizon, if we're able to, and there aren't other priorities, we generally tend to do something about it. That might be looking at a forecast on your phone and deciding to take an umbrella out with you, or knowing that it's going to be summer and planning some kind of holiday. But in the kind of more humanitarian setting or disaster response, it's really about trying to use early warning information in order to reach people and deliver assistance a bit earlier than normal. You'll all have noticed and seen kind of brilliant images of, search and rescue teams after earthquakes, where they deploy on aircraft and fly across the world and help people. That kind of response is brilliant, but for many crises, we actually know that they're unfolding before they happen. And the earlier that we can reach people, the less that they lose. We can reduce suffering. And there's also quite a big financial incentive, because it's cheaper to fix a problem before it becomes a big problem than it is to respond late. Flying those teams around the world and flying food somewhere is very expensive. Whereas if you can help people out beforehand, it's much, much better. In terms of COVID-19, this early action looks different in different places. In some cases, it's trying to develop a vaccine so that we know that the infections will come back, or they'll continue until people are able to be immune to it. But it also means at the community level, really trying to anticipate the healthcare needs of vulnerable people in advance. As we've seen the virus spread around the world, you can see from countries that don't have it yet, perhaps, or don't have large numbers of confirmed cases, and you can track the progress in other countries and start trying to implement measures ahead of time. And I guess what Sarah and I will really talk about today is really trying to think through how you can do that for the poorest and the most vulnerable, because it is often those people who are most affected by these emergencies.
Great, thanks, John. So the START Network, organizations in the START Network are actually on the ground responding to situations. So Sarah, can you tell us what the START Network has learned from past disease outbreaks and how this is informing current COVID-19 work, and how this might be different to experiences you've responded to in the past? And can you give us some examples of your work on the ground?
Sure. And I guess just to start with a very big thank you to the IKEA Foundation. When we started our COVID work, you were the very first donor that supported us. And as you can imagine, in a situation like this, it's so important to have fast funding, especially if we want to do early action work around COVID. So a really, really big thanks to the IKEA Foundation for your fast and flexible funding. And this is a message we've been sharing to others now. So thank you for leading the way. But before we began any of our projects, we really wanted to make sure that we were learning from previous experiences. So we went back and we looked at projects that we had implemented that focused on responding to a disease outbreak. So we looked at Ebola projects, Lassa fever, dengue, cholera, and we also looked at the wider sector, and we talked to a lot of our partners just to make sure that we could learn from them as well. And a few really interesting themes came out. One was the importance of dealing with misinformation in the middle of a disease outbreak. And as we can see right now, there's a lot of misinformation circulating around COVID. And this is something we saw in the Ebola outbreak as well. And so for the humanitarian charities that are involved in responding, we're not only working to share helpful information about COVID, but we're also dealing with misinformation as well. One of the other findings we found that it's really, really important to consider child protection issues in the middle of a disease outbreak. As you can imagine, chaos breeds chaos. And so unfortunately, something that we've seen is that in the context of a disease outbreak, child protection issues seem to increase. Children are more vulnerable. So we've been working with our staff, making sure that child protection is considered in all aspects of the projects that we're implementing. And we're working with healthcare providers as well on that. And a final learning, and I think this is just a really, really important one, around the importance of involving the local community. If we want to share information about COVID, if we want to do that in an impactful way, we need to involve the local community. People want to hear information from trusted community leaders, not necessarily an outsider. And so I think we've been really, really trying to partner with local community members. And currently we've got 17 live COVID projects in 17 different countries around the world. We're focusing on low-income countries. We're focusing on working with very, very vulnerable communities, communities that may be left behind, such as refugees, migrants, internally displaced people. And we've been really working to respond to COVID, but then we really want to mitigate the spread of COVID as well. So we've been doing lots of things like community sensitization, sharing information about how to avoid the spread of COVID, training healthcare workers. We've also been responding to some of the secondary impacts caused by COVID. So we're seeing things like increased food insecurity. So we're working on that as well. To give you two quick examples, we've got a project in Libya. And as you can imagine, the country experienced a lot of instability over the last period. Health systems were really, really weak. And so we're working with a national staff there. We're training them, we're supporting them with personal protective equipment, and we're helping out with some food distribution as well. We've got a really interesting project in Laos. We're working with marginalized communities there in northern Laos. These communities are particularly vulnerable because they don't have access to health services, and health information is often not translated into their local language. So we're really working to translate that information, share information with them, just because they are so marginal. So that gives you a little bit of a taste of what we're doing.
Great, thank you, Sarah. So in this particular crisis, obviously we've seen the worst impacts in regions like Europe and North America, and have yet to see the full impact of COVID hitting geographies like Africa. What do we expect to see happen there, John, and how is REAP responding?
Yes, so I mean, unfortunately, I think the prognosis for many places, including kind of many of the already fairly hard hit countries in terms of the humanitarian caseload or economic woes in Africa, the kind of the outlook isn't great. And I think that's probably related to two things. One, the direct impacts of COVID-19, and then two, the secondary impacts of it. And so I guess briefly on the direct impacts, I guess it's still hard to tell. There is limited surveillance in these countries of kind of infection rates and things like that. So time will tell just how many people get affected and what kind of impacts that has, not only in terms of health impacts, but also impacts on their economies. But I think more broadly, the wider and secondary impacts in many countries in Africa are going to be really hard felt, and they already are. For example, anytime there's a lockdown, people's ability to access markets, to sell their food, to buy their food, to send children to school, to access normal health care is severely reduced. If you imagine that you're an organization running an immunization campaign in South Sudan, do you continue with that immunization campaign, or do you try and provide COVID-19 assistance to those direct impacts, or do you try and do something else? And so there are many, many very tough risk management choices for many different organizations. And certainly what REAP as a partnership is hearing from its partners, which include members of the UN family, like the World Food Programme or the Food Agriculture Organization, or NGO partners like Start Network, what we're increasingly hearing from them is that, the situation in many countries that we work with, the poorest people in the world, it was already very difficult. 2020 was the highest number of people in need of humanitarian assistance that there's ever been. There's one of the biggest shortfalls in humanitarian funding that there has ever been. And then COVID-19 happens and all of these other impacts. Another potential factor is that for many countries, their overseas development spending, so many of the European countries, the UK included, is related to their gross national income. Clearly, that will probably go down because of shocks to the economy and other spending to ease the burden of COVID-19. So what extra money is available for overseas aid spending may again decrease for lots of different nations. We see some things like the US, for example, being reticent about continuing funding for WHO and other big organizations like this. So the shocks of COVID-19 are really going to be felt in multiple different ways. And certainly when you look at one of the REAP partners, World Food Programme, are warning of the potential for biblical scale famines in different places in East Africa in the next year or after that. And I think that when we look back in 5 years' time, we will see that there have been huge problems for many countries. We won't necessarily be able to pin our finger on it saying it's COVID or it's climate change or it's economic shocks or things like that. But in some ways, it doesn't really matter what the attribution is for the blame. What matters is the action. And that's why it's brilliant to see what Start Network's doing in terms of thinking about how to act early. The money goes further, people are helped sooner. And we sort of minimize the loss and suffering in the long run. But yes, so sort of just to summarize, really, the outlook isn't brilliant, not only for Africa, but for many other kind of countries in kind of lesser economically developed areas.
Right. So thinking specifically about how COVID might be different to other crises, Sarah, I'd be interested to hear what in particular are the organizations in your network worried about when thinking about COVID as compared to responding to the Ebola crisis or responding to flooding or any other crises that they might have to deal with? What's particular about this situation that worries them?
Yeah, I think for start, our focus has been small to medium scale crises that don't tend to get a lot of media attention. So COVID definitely does not fall within that category. We started working on it just because we saw the need. We were having conversations with our members and they were saying, we're really concerned about this. We want to work on this. So we started our COVID work. I think no one was really prepared for the scale of this pandemic, and no one was really prepared for the mitigation measures and the impact of those mitigation measures on communities. And I think this this pandemic has actually really challenged the entire humanitarian sector. It's challenging how we have traditionally worked. We're seeing lockdowns. We're seeing people grounded. People can't fly. The humanitarian community, we can't surge in international staff to respond. And so I think this pandemic is really challenging the way that the humanitarian system has been working. And at START, we have been challenging this way of working as well. One of the things that we think is really important, one of the changes that we want to see in the humanitarian system is we want to see local humanitarian actors prioritized. We want to see local organizations get more funding. We want to see local actors given more decision-making power. And in the context of this pandemic, it is those local actors who are really leading the way. They are the ones who are responding. And of course, we were going to keep sharing that message. We really need to prioritize those local actors. We're also sharing the message that we need local humanitarian organizations to be considered key workers so that they are able to move around when it is absolutely essential, so that they can provide services to the community when it's necessary. COVID's obviously getting a lot of media attention, and it has really impacted the Western world. And I don't want to downplay how serious and how devastating this pandemic has been. But I think for us, in a lot of the countries that we work on a day-to-day basis, we see our partners managing humanitarian crises every single day. And these are crises that don't tend to get a lot of media attention. We had members in Bangladesh just over the last few days raise an alert because they're going to put a project in place to respond to a dengue outbreak. And they're dealing with dengue and COVID. So you can imagine there's just so many risks to manage. And so I think one of the messages that we really want to get out there is it is very, very important to respond and to prevent COVID. But we also need to not divert all humanitarian funding just to this one issue, because there are so many other risks that our members are managing on a day-to-day basis.
Thanks. You actually answered my next question, which was about the importance of local organizations in response. Can you give us some examples of the members of your network who are not global brand name NGOs, but are smaller local organizations?
Yeah, so we've actually established a group we call Forewarn, the Forecast-Based Warning Analysis and Response Network. And it's a group of early action experts that are operating all on the national level. So we've got a really active group in the Philippines, in Bangladesh, in Madagascar. And this group is bringing together local universities and local humanitarian organizations. And these groups are helping to analyze risks so that our members can respond early. And a lot of the time, this analysis has happened more in global capitals like London, but we really want to see this risk analysis happen on the local level. And that's why we're really excited that these communities are coming together, not just of local humanitarian organizations, but local universities, and we're having conversations about risks so we can act early. But we're seeing really great work come out of Philippines, Madagascar, and Bangladesh.
Right. So back to you, John. Back to early action and what this really means. What are some of the challenges that you face in trying to take a prevention and a early action approach, as opposed to an emergency response approach? And can you just give us a few more examples of exactly what REAP does?
Yeah, and if I might actually kind of start off by building a little bit on what Sarah was saying about the kind of the importance of being as local as possible and really working with and through communities. I don't know where all the listeners are watching from today, but you yourselves probably with lockdowns will have experienced the real power and ability of communities to support each other. You might have loved ones who have not been able to go out of their house, and how you have helped to deliver shopping for their them, or supplies, or toilet roll, or whatever it might be, or maybe even IKEA furniture if that's what they've needed. Sorry, I couldn't resist mentioning furniture. But you know, we have all relied on each other a lot at these times, and I think when our kind of host government or our state is overwhelmed by big crises like this, it really often does fall to volunteers. It does fall to communities, and that's why within the kind of the humanitarian system, within the early action system, we're really trying to prioritise that, which is why it's brilliant that the IKEA Foundation is supporting START network in this way. And indeed, many of the REAP partners are really trying to work in that way. The REAP Secretariat, so the organisation that kind of sort of organises the partnership, is hosted by the International Federation of the Red Cross and Red Crescent. And of course, that's one of the largest volunteer organisations in the world. And all of their work, again, kind of in communities is done in that way. So what are we doing? What are the challenges with early action? Well, I guess the big challenge with early action, and possibly one of the challenges that we've seen with COVID, is that even when we know there are crises on the horizon, it's very difficult to choose to spend money on them today, when maybe you might wait for it tomorrow. It's one of the big challenges that we all face in our lives at the moment. You know, I think as a society, we've got a little bit better at investing in ourselves, whether that's for personal well-being, like sport, because we know that it might make us healthier in the future. But for lots of other things, whether it's our own personal finances, our country's attitude towards risk, our own organisation's attitude towards risk, it's really difficult to spend money now for the future. And the big challenge with that is that so much evidence says that if we spend money now, it's much more efficient and effective in the future. And early action is that kind of is a real kind of show of that. But it's really difficult. The first kind of barrier to it is that kind of money one. You know, if I have £10 here, why would I spend it in the future when I could spend it on real need now? And in fact, that happens within the humanitarian system itself. I think this year the UN asked for $29 billion of assistance. Clearly that number's going up with COVID. There will be a big shortfall on that in terms of what they actually get. So when there's not enough money for the amount of need out there, it's very difficult to spend future money. The second problem is that even if you decided that you were going to act early, what then people want is a bit more of a guarantee that something's going to happen. And so, for example, you could want to act early to a flood. But for a flood, you might have weather information that you need. You might need to know levels of the river. You might need to know where people live. And all of these things, you can build these complex risk models, but they take time, they take resource. And so this information, this early warning to enable early action is something that's quite difficult to do. And as Sarah says, the more local it is, the better, because locals, at a local scale, you know where your neighbours are, your communities are, you know within a district what resources they have. And there has been this kind of past way of doing this where everything's been done centrally, where it's like people think that there was this big kind of computer where you put in what's happening in the world and then it would say, here's where you should act. Well, as we all know, things are a lot more nuanced than that. And I think it's one of the things that COVID has shown us. So that's the second challenge, this availability of early action, of early warning. The third one is, even if you have the money to spend, you have the warning to do, what kinds of things should you be doing to help people? So, you know, if you think there might be a flood, should you be giving people boats or life rafts or life jackets? Or maybe should you be delivering cash assistance? Because if they lose things, then they can spend the cash on replacing what they've lost. And if they haven't lost things, then hopefully you've targeted the people who are most vulnerable anyway, and they could use that cash to improve their lives in some other way. And so that's where this kind of real importance around targeting comes in. And so what REAP is trying to do across these kind of different areas is one, improve how we think about the money and how we can spend more money earlier. Two, improve these early kind of early warning. And then the third thing, again, improve how it is that we actually deliver this assistance. Because I think, unfortunately, when early warning, early action kind of started, there were lots of initiatives where people got warning for something and then acted in a very obvious way. So there might have been floods and they acted with boats. And then the flood wasn't as bad. And so all the money spent on boats was kind of pointless because the floodwater didn't reach the places where the boats were delivered. But I think what we're trying to kind of encourage with our partners, and what you see kind of increasing evidence, is that if you think a little bit more carefully about the assistance that you deliver at these times, then even if the flood doesn't happen, you're still helping people. And that's what we're really trying to push through and kind of get this kind of global kind of agreement and policy on it. And whilst it's bad at the moment for COVID-19, it's going to get a whole lot worse as climate change impacts really start to bite. We're going to have multiple, we already are having multiple disasters layering on top of each other. We saw just a couple of weeks ago Tropical Cyclone Harold hitting Vanuatu during a time when they were doing social distancing. They had tough decisions to make. And these impacts are going to be felt more and more, and they'll be felt more and more by the most vulnerable. So I think we know the challenges with early action. What we're really trying to do is make sure that we're joining all of these different bits together, so that we, people aren't left behind.
Great. And I know both of you have a lot of experience on the ground and have worked with each other as well. Can you give us some specific examples where early action and either having early information or early funding, either direct to people in communities or to local organizations, has had a really positive outcome in terms of coming out of that emergency?
Sure, I can jump in there and provide an example. We had a project a little while ago in Pakistan, and it was in anticipation of a heat wave. I know sometimes in the UK we think, oh great, the sun is coming, I'm excited. But these are quite deadly in different contexts. Heat waves claim the lives of many people in Pakistan every single year. One of the challenges we have with acting ahead of a heat wave is having clarity about the forecasts that our members were looking at in Pakistan. And one of the issues is that there's actually so many different sources of forecasting information. It can be quite confusing which one you look at, which one you trust. And it's also quite confusing, how early in advance do you act? Do you act 2 weeks before that heat wave? Do you act 1 week before that heat wave? And what we were seeing was our members were missing that opportunity to act. And unfortunately, the heat waves were striking. We saw mortality. But we struck up this partnership with the London School of Economics. And they worked with our humanitarian agencies on the ground in Pakistan to analyze different heat wave forecasting sources so that our charities could have more information about which source was the strongest. And they also helped to clarify, LSC, how many days in advance of a heat wave can we act? And we came up with a lead time of 7 to 10 days. So this is when we have enough certainty in the forecast to actually release funds, but we have enough time to actually implement projects. And so through that partnership, we were able to anticipate a heat wave in 2018, and we worked with different charities on the ground, putting in water hydration points, sharing heat wave information in advance in really creative ways, using mobile phones, etc. And so it was really, really neat to be able to anticipate that heat wave successfully. And it was also great to work with the academic community to improve our ability to do early action.
Right, John.
Yeah, and maybe if I might share a couple of examples, if you'll allow me, one on a kind of slightly longer timescale and one on a shorter timescale. Several years ago, I was working in rural Zimbabwe, and there were communities there dealing with persistent drought. Kind of climate change was affecting the predictability of the rains. The rains would come late, or they would not come at all, or they'd come in drips and drabs. And not being a farmer myself at all, I didn't understand a huge amount about this, but I understood that it was a big problem. People didn't really know when to plant. People didn't know what to plant. What they had done before wasn't really working. And the problem for many of these communities was the lack of water. So the solution that they were asking for from NGOs was more water, quite naturally. So boreholes, things like that. And in working with the communities and discussing with them, and really, rather than change it, having this relationship whereby they would ask for an NGO to give them something, by partnering with them, actually what we managed to uncover was that boreholes perhaps weren't the answer. Even if they had more boreholes with climate change, the water table might decrease so much that there wasn't water in the future, so they were only offsetting the problem for a little while. But rather that maybe they could plant different seeds, they could do different things, they could work together as a community, they might even be able to explore how to use weather forecasts rather than just expecting the rains to come at certain times. And so really with that kind of partnership at that real local level, I think we managed to make some, great breakthroughs. Now the challenge is that was 10 communities scaling that up, but there really is a movement within the wider kind of development community to be acting and working like that at a big scale. And then at the kind of shorter scale of early action, last year, in August, when I was working for the UK government for the Department for International Development, there was kind of a warning that a cyclone, Cyclone Dorian, was heading towards the Caribbean, was heading towards the Bahamas. So what we were able to do is there was a UK military ship in the area, managed to turn that around 3 days in advance of the storm arriving. It arrived in the Bahamas as the storm was hitting, as did I and a team of people. And we worked with the Bahamian authorities and other international actors, other governments, the US, the EU, to deliver assistance. And it meant that as soon as the winds died down enough for this naval ship to launch helicopters and boats, they were doing that, and they were delivering assistance to people on the ground. They were clearing roads, they were delivering water and food and shelter. And so it's possible all the way from those few days of knowing when a cyclone might be hitting, all the way to that longer term adaptation to droughts, that it's possible to act early. And I think the main thing that I'd stress, and I don't mean it ironically kind of working for a partnership, but is this real importance of partnership. No one institution has the solutions. No one community or government or agency or academic has all the answers. There is unfortunately no one model that fits all. There is no perfect way to deal with all this. It is through this collaboration, through genuinely putting those who are last first, that we will manage to do as well as we can with these different crises that we face.
Right. Both of you have mentioned climate and the effects of climate change on your work. And of course, the IKEA Foundation is a foundation that's deeply committed to protecting our planet and fighting climate change mitigation and helping communities adapt to climate change. Can you give some more examples of the effects that climate change is increasingly having on a humanitarian response and ways we can think about, especially as philanthropies, adapting to that?
Sure, I can jump in there. Yeah, so I think when we speak about COVID, we're talking about a disease outbreak. And again, it's been devastating, and we're still seeing the impacts of this unfolding. Unfortunately, what climate change is doing is negatively impacting every single hazard that the communities we are working with are managing. So for example, we're seeing an increase in the number of heat waves. We are seeing an increase in the number of floods that we're responding to. We're seeing more droughts, more food insecurity. And so, as John was mentioning, we're seeing this increased demand for humanitarian funding. And so I think in the context of climate change, and I think it's really, really good to hear that the IKEA Foundation is concerned about this, I think early action is even more important, because we need to manage these risks that are growing in the context of climate change in a more efficient way. Early action, it can save lives and it can save costs. And so I think, in the context of climate change, we need to be really acting earlier so that we're mitigating the impacts of climate change instead of responding late when a disaster has already occurred.
Yeah, and I completely agree with you, Sarah. And I think I think for our children, if you've got young children at the moment, my son is 3 months old. I think when he's older, climate change will still be the big thing that dominates the world and the impacts, especially on the poor. And we'll look back on COVID, and COVID will have been and is very bad. But unfortunately, climate change impacts are, very likely to dwarf that. That's what all the kind of expectations are. But of course, as we know in this world, nothing is really not connected. And in the future with climate change impacts, they expect to see more communicable diseases. Mosquitoes with dengue will come to Northern Europe potentially. All sorts of things like that. But I think what it really shows us, this connectedness, is that at the moment with COVID responses, there should be an eye on the future. And one of the partners, the UN disaster risk reduction group, are really thinking through, how do you encourage people who are making difficult decisions about how to manage their COVID risk? How do you get them to think about the future? How do you think about climate change when you're thinking about COVID? We're seeing some brilliant interventions from organizations like UNICEF or other charities who are doing hand washing campaigns in communities. Hand washing obviously really helps with COVID. It also really helps with diarrheal diseases. It helps with child nutrition and health, and it's all connected. So I think our big encouragement, and lots of organizations are really encouraging those when they're spending money to think, how can we spend money on COVID emergencies, but that they're COVID interventions, which are climate kind of sensitive and climate smart, and really thinking about the future. And I think there's been a lot of discussion about re-greening the world after COVID. There's those great articles about reductions in CO2, reductions in air traffic and pollution, things like that, and people talking about building up economies again. When we're doing that, we shouldn't just be aiming for green, we should be aiming for climate resilient and climate sensitive, and putting the kind of the poor first. And then long-winded answer to your question, sorry, but what can philanthropy organizations do? I mean, they have an awful lot to do. A lot of the work in this area has been kind of dominated by governments, sometimes with lots of power as donors, or NGOs. And this move towards more local people, the move towards the private sector funding things, philanthropy organizations, is increasingly important. And that's why it's brilliant to see the IKEA Foundation and the kinds of ways that you all work. It's vastly reduced in terms of its political oversight. It's able to be flexible and fast. You were the first donor that was able to support the START network. Others are slowly coming on board. You're able to move really quickly. And I think as we get used to these climate risks and changes, we're really going to need to be dynamic like that.
Right. Well, let's imagine we've got some people in the audience, big pockets or small pockets. We've talked about the importance of early action. We've talked about the importance of supporting a local response. Where are the biggest needs, and how do we ensure that the money gets there?
I can jump in. So I think there is a few. There's obviously that big message. We need fast and flexible funding right now to respond and to mitigate COVID. We really want to ensure that funding gets to local actors. START Network is one of the agencies that is able to do that. So I would really stress that. And I would also say, and I know I've said this before, is we need to give more decision-making power as well to local actors. These are the people who are going to experience the effects of COVID in vulnerable areas the most, and they are on the ground. So I would stress that message as well.
Fantastic. And if you have deep pockets and you're on this call, then I probably assume that you're already investing in these kind of things. But I would encourage people to continue looking everywhere for the needs. The needs are all around us. They're in our communities. They're sometimes in our own homes. And of course, they're dramatically affecting the poor at the moment. And I think that kind of compassionate approach of seeing need everywhere means that, as Sarah says, you really are able to put those who are reasonably powerless and help them to have a lot more choice, hopefully, over the course of their lives, and enable them to continue in a kind of a rate of progression despite these disruptive challenges of climate change and COVID. And so, yes, continue to be inventive with where you're spending your money, continue to support these initiatives that really put the last first, like Start Network does. And I would strongly encourage people not to settle for just doing the same old things that we've done for the last 20 years. It's worked a little bit, but it's not enough, and we really need to sort of change the game. Early action is one of those things, but of course, you know, there are many other important facets to it too.
Terrific. Well, thank you to our experts, Sarah Klassen and John Stone of the Start Network and REAP. We really enjoyed hearing about your work. And thank you to all of you online for joining us. We hope that the session allowed you to better understand what's important in emergency response. And I think we heard local, and I think we heard early action. If we remember anything from this session, I think those two are the most important messages. And as a third, certainly, that's even bigger than COVID-19, which is overwhelming us now, and we don't know how long it will be till a vaccine helps us find our way out of this crisis. But climate is the much bigger threat here. So with those messages, thank you to Sarah and John. Thank you to all of you online for joining us. And whatever questions we didn't get to here, we will make sure that we publish online responses to those questions. And back to you, Ryan.
Absolutely. Thanks so much, Patricia. And thank you for hosting. And to Sarah and John, you know, I think proactive versus reactive is something that we talk about a lot, you know, businesses, philanthropy, any organization. And I think it just highlights the importance of how that can have such a big impact on communities and people here. So I really appreciate you taking the time to help us understand a little bit more about what that means for real people on the ground. Thank you so much. To all of our viewers, we'll be back again with another Ask an Expert. Keep an eye on the website. Please keep submitting questions and liking, sharing on Facebook, YouTube, LinkedIn, all that good stuff. And thanks so much for your time. We appreciate it. Have a great day, everyone.